we're going to chat through BVD and really start to talk a little bit about some of the diagnostics and how you might get to a point where you can achieve a BVD-free herd. Last time we talked about information about the control of BVD disease in Europe and the control of the disease in Europe, and we spoke about the pathogenesis of the disease and how it would affect your herd if you had it present. And this evening we're going to talk about diagnosis and control and the pathways that are involved in getting to that. And again, if there's more information that you'd like to know about this disease afterwards, you can go to the RVC website here where we've got lots of presentations and information about BVD. So like I say, last time we talked about control in Europe, control in the UK, and then the disease itself and how it affects an individual and what this might mean for your herds. And really the highlight, I think, was about these persistently infected animals, and we're going to talk a bit more about them tonight, and just how we find them in an infected herd here. And of course, it's the presence of a persistently infected animal that causes other animals to become acutely infected, and it's this acute infection that might end with decreases in fertility, increases in immunosuppression, and therefore increases in respiratory diseases and scours that you see in your herd. And so the fact that there's a PI present acutely infecting other animals in the herd is what's leading to economic and production losses in infected herds. So the first thing I think that we just need to cover is what defines an infected herd. And I quite like these two quotes that come from a paper that was written by a Swedish lady called Anne Lindberg. And she says in this paper that in practice a herd is not infected until one or more PIs have become established. And so really what we're saying is if your herd doesn't have a PI animal in it, it's not really considered to be actively infected with BVD. The other thing is that we know that BVD cannot persist in a herd where contacts between PI animals and susceptible animals in early pregnancy do not occur. So last time we spoke about how PIs themselves are produced, and the key thing about that is that a pregnant animal carrying a fetus has to be in the first third of pregnancy, and if she comes into contact with a PI animal herself, she becomes infected, the fetus becomes infected, and if the fetus isn't aborted, it'll become PI, and if it's born, it'll become a PI animal, and it will spread the virus on the farm. So we've already mentioned PIs lots in the first few slides of the presentation, and just to remind you, sometimes they can appear like this. So this is a PI calf here. This animal next to it is the same age, but we can see this animal suffering from the classic stunted growth, mucky back end. It just looks like a really poor calf. But there are other occasions, of course, where you can't pick the PI out from the rest of the crowd, and this animal here was PI in this group. But just looking at them, you might not be able to pick her out particularly as a different animal from the other animals that she's mixed with. PI cattle, they're infected for life. They're carrier animals, and they never produce their own antibodies to this disease, so they never clear the virus. They produce lots of virus in large quantities, and they spread it around in nasal secretions, urine, feces, milk. All of their bodily secretions are infectious to other animals in the herd, but particularly the nasal secretions. So nose-to-nose contact, if we were going to think about farm fences, nose-to-nose contact with a neighbouring PI animal could be one way that your herd could get infected. But PI animals infected for life, carrier animals, and they produce large quantities of the virus, so they're very, very important in the epidemiology of this disease. And I think we mentioned this figure last time, but what we found in a number of herds we worked with in Somerset on a BVD study that I was involved with was that the number of PIs in an infected herd ranged from 0.3% of the herd up to 3% in the most heavily infected herds we were looking at. So we're looking at less than 1 and up to 3 in 100 animals, really, that could be infected, persistently infected with BVD. And the other interesting thing about this figure is that it was highest in non-vaccinating herds. So we were seeing higher levels of infection in herds that didn't use a BVD vaccine. And so that probably just is an obvious thing to say. But the other side of that is that we were still seeing PIs in herds that did use a vaccine. And so the other thing to emphasize here is that you won't be able, or it's unusual for you to be able to eradicate BVD by just using vaccines alone. The vaccines help a lot, but we have to find these PI animals, we have to cull them out of the herd, and then we can get the herd to a BVD-free status. So, how do we proceed to BVD freedom? The first things we ought to consider are just generally what we would require in order to find our PIs, find our infected herds, and then find our PIs within them. And the thing that we really need are good tests. And the good news is that we have these for BVD. So a positive is reliable and a negative is generally reliable for this test. They're very good, and so we don't need to worry too much about the accuracy of the tests. No test is 100%. But the BVD tests that we've got on the market at the moment are very good. And we can define a herd status. So does a herd contain a PI? Has a herd been exposed to BVD, and is it likely to contain a PI? And where we find those herds, we can find and we can identify the PIs. The other side of that is, of course, if a herd hasn't been exposed to a PI, and we define that by looking at the herd status, what we need to do then is not search for PIs because they're non-present, but we need to protect that herd and make sure that its biosecurity and vaccination are good enough to make sure that it doesn't become infected. The other thing to mention here is that our tests are actually pretty cheap in the grand scheme of things compared to some of the other lab tests. If we talk about some of the common tests that we will perform on an individual animal, we're probably talking about £3 or £4 from most of the laboratories. So for an antibody ELISA or an antigen ELISA, we'd be looking at £3 to £4, something in that region, depending on the laboratory. So lots of you will have done bulk milk antibody tests, and they should cost about £3 to £4 for that one bulk milk sample. The other thing we will need to talk about is biosecurity enhancements, and I've got a few more slides on that later, but the important things with BVD are that we don't buy a PI into our herd. And so we need to consider a number of things, but the main things to me are we need to consider contact with cattle of an unknown status. So this might be a cow that you've brought into your herd. If we don't test it for BVD, we don't know if it's a PI or not, then this could be a way that BVD is brought into a herd. Neighbouring cattle, if we don't know our neighbour's status, and our neighbour may have a PI that grazes on a border where your cattle graze as well, if they can have nose-to-nose contact over those fences, then there's a risk that the infection can spread from farm to farm that way. So test purchase cattle, we're going to talk a little bit about what tests we could do and what we need to know about these cattle that we're buying into our herd, and then biosecurity with neighbours. These are the key points really that we need to highlight from a biosecurity point of view with regard to the control of BVD. Vaccines are another thing that we need to mention here. The purpose of the vaccines that we use in adults that are out on the market is to protect this mother, and by giving her enough immunity, we prevent the infection passing to the fetus. And so by protecting her, we prevent the production of more PI animals. So we covered how they were produced in the last webinar, but what we need to do is make sure that the mother's immunity is good enough to stop that virus crossing the placenta and infecting the fetus in order to ensure that we don't produce more PI animals. And then one of the biggest things I think is really, your relationship with your vet as well. The presentation tonight is going to talk very generally about diagnostics and how we might use them to diagnose herds that are or are not infected with BVD. But only you and your vet know your herds well enough to tailor the tests that we're going to talk about to your specific situation. So it's really worth getting in touch with your vet and talking about BVD with them in order to come up with a tailored approach to BVD diagnosis and control within your herd. So I've got a bit of a long flow diagram here that I draw for BVD eradication, and this is just the process that I go through in order to try and eradicate this disease from infected herds. The first thing that we really need to think about is biosecurity and vaccination. So is your biosecurity good enough to keep this disease out of a herd? Is your vaccination status and your vaccine protocol good enough to protect your herd. And this is particularly important if your biosecurity is difficult to control. Disease history is another thing that's worth thinking about at this stage. If you've got cases of infertility, if you've got cases of calf pneumonia, calf scour, if you've had a case of mucosal disease in the past, these can all be things that hint at a BVD problem, and so it's worth discussing and thinking about before you embark on a BVD control program, because it might just give you a little bit of a hint about which way the program will go. If these two things particularly are not satisfactory, then talk to your vets again. Get some advice on what to do about biosecurity on fences, what to do about those brought-in animals more particularly. How do I need to test them? What should I do? Talk to your vet about the need for vaccination as well. So again, this is particularly important if biosecurity is difficult to control. When you get to a point where you think you've got this to a level that is satisfactory and is going to have an effect, the next stage that I like to go through is a herd screen. So this isn't a whole herd test. We're not testing every animal in the herd now. We're testing small cohorts. So we might do a bulk milk sample. We might take 10 young stock aged between 9 and 15 months in the herd and test these for antibodies. And by looking for antibody, we're really looking for exposure. So antibodies in this case tell us if an animal has been exposed or if a group of animals has been exposed to the disease. So if your bulk milk has antibodies in it, if your young stock that are tested have antibodies in their blood, then this is an indication that they've come across a PI at some point and may have been exposed to the virus. And so if the risk is that there's a PI running around on the farm causing high levels of antibodies in your milk and the bloods that are taken from your young stock, then this is telling us that we possibly need to look for that PI within your herd in order to identify it and cull it out. If you're lucky and your bulk milk's negative and your young stock are negative for antibodies, then this really tells us that there have been no PI animals on the farm, so there's been no exposure to the disease. And the key thing here is to set up a sort of circular surveillance system. So basically you're cycling around and you're repeating this step here. You're looking at 10 young stock, bulk milk antibody on a regular basis in order to make sure your herd doesn't become infected. If you don't have PI animals, then protection and keeping the disease out is the most important thing, and surveillance will form a small part of that to make sure that if the disease does get in, we can act quickly and we can know which animals we might need to look at that may have brought the disease onto your herd. If we do have antibodies in the young stock and we do have antibodies in the bulk milk, then the likelihood is that there's a source of exposure on the farm, and this is generally because a PI animal is present on the farm. So there's active BVD circulating on the farm, and in this case we need to think about tests that are going to look at all of the animals on the farm, maybe in one go, maybe over a prolonged period. It depends on how you want to tailor this to your herd. But we can use our tests to look for PI animals, and once we find them, we cull them out of the herd. And so we'll talk a little bit more about these tests later on. Once you've had a period of 12 months without the discovery of any further PI animals, the likelihood is that you've eradicated them all, so you've culled the ones that you've found out of the herd and no more have been produced. And at this step, you can enter the surveillance and protection phase of the study, of the protocol here. And really, it's about going back to this regularly again and protecting your herd. So you're up here back at the herd screen again, and you just test 10 young stock regularly, so maybe twice a year, and a bulk tank antibody maybe quarterly, in order to make sure that your herd doesn't become exposed after you've gone to the effort down here of finding and eradicating the PI animals from your herd. How long could this take? The herds that I've eradicated BVD from, the quickest I've done it is 18 months. So that was a whole herd test on one day. We found the PIs, and then we tested the young stock that were born after that for a year, and we removed any PIs that were in the young stock group. Realistically, 2 to 3 years is probably a reasonable time for this, but we've done it as quickly as 18 months in some cases. So it's not a particularly long-term undertaking. If we were talking about Johne's disease, we might be talking about something like 10 years here in order to make sure that we eradicate it efficiently and control it within your herd. But BVD, we can have a much quicker win. So if we take those first points, and biosecurity first of all, the big things, like I said earlier, are boundary fences and incoming stock and contact with stock of an unknown status. And the thing about biosecurity is you can include as many diseases as you like in this at this point. We don't just have to talk about BVD. We're going to focus on it for this talk. But really, if you're worried about IBR and other diseases coming into your herd, IBR, Johne's, you could come up with biosecurity protocols in conjunction with your vet. So testing, questions that you're going to ask the farmer that you're purchasing from, and purchase protocols really, so that we can keep these diseases out of your herd. With BVD, boundary fences are quite an important thing, and we do know that this will spread quite readily across fences, so from farm to farm this way. So if you graze cattle on the boundaries of your farm and other farmers graze on those boundaries as well, you have to really ask yourself the question, is my neighbour BVD free? Is the disease likely to come in this way? Am I likely to spread it to my neighbour by grazing on the boundary as well if I don't know my current status? So trying to think about boundaries is quite important. The gold standard procedure that we might go through would be double fencing. That's not something that everybody can afford to do or want to do. And so coming up with some sensible things that might be possible for your farm, maybe growing crops on the boundary, just grazing young stock on the boundary that are not pregnant, talk to your neighbour and don't co-graze on the same boundaries at the same time. These are all the sorts of things we can start to think about doing if we know your farm. The other thing that works the best, of course, is if that you and your neighbour's neighbour all work together towards the same disease eradication aim, and if everybody's BVD free, we don't have to worry about BVD coming in across the fences. So working together, I think, as a community can be quite a good way of dealing with this issue of boundary fencing. The other thing, of course, is incoming stock. It would be unrealistic to tell you not to buy stock in. If you can do that, that's the perfect type of biosecurity here, but lots of farmers need to buy in animals for various reasons. And I think the key thing, and one of the biggest messages I'd get across to you guys here, is to ask for the question about the status of the animal before you even bring it onto your farm. If the seller won't tell you about the status of the animal, then it's probably time to look somewhere else and to buy an animal from somebody else who will test that animal and will show you that it's not PI before you purchase it. If you buy from markets and things like that, this becomes a little bit more difficult, and maybe we have to think of a way of isolating these animals that are bought in and testing them before they're mixed with your main herd. And this could be as simple as buying them in and keeping them on a pasture that isn't grazed or grazed next to any of your other animals. If they're milking animals, it becomes even more difficult, but maybe we just have to milk them last. So after everything else has gone through the parlour, milk them last and try and keep them away from your main herd until they've been tested. If you can buy in heifers, before they have to enter the milking herd, this makes the job a whole lot easier. So we can purchase those in, we can quarantine them, we don't have to worry about mixing with milking animals, and we can test them. The main thing that we're testing for is to check that they're not persistently infected. The last thing we want to do is to buy a PI onto the farm, because this is the way that many, many farms become infected. Don't ignore the issue of acute infection, but this is a much smaller issue compared to the purchase of persistently infected animals. The other thing I will highlight here is in-calf animals. If you buy in-calf animals, we can test the dam, but we cannot test the fetus. And so you can't get a status for this fetus in terms of its BVD status until the animal's been born and tested on the farm. So if you purchase in-calf animals, do be aware of this. We can test the mum, but we can't test that fetus. And so it's almost like a Trojan cow or Trojan horse bringing the disease onto the farm in an unseen way. This is how seriously my boss and I take biosecurity at the Royal Veterinary College. So this is Professor Brownlee, and this is me checking that he's biosecure before we went to a blood test on a farm to look for PI animals. So we take it quite seriously here. The other thing to think about them is particularly important if your biosecurity is difficult to control is vaccination. Like I said earlier, the purpose of the vaccine is to give the mother immunity to stop the virus crossing the placenta, infecting the fetus, and causing the production of more persistently infected animals. So if we vaccinate her, we have this barrier between the virus and the fetus, basically. If her immunity is good enough, we won't get fetal infection. Some key things with the vaccines, though. We need to give the primary course prior to first service. So heifers need to be vaccinated before you're thinking about putting them in with a bull or AIing them. You need to boost as directed by the manufacturer, so check this with your vet. But do remember that used alone in an infected herd, we don't necessarily end up with an eradicated herd if we just use vaccine alone. If your aim is to eradicate BVD from your herd, you need to think about looking for and removing PI animals. But the key thing is use these vaccines as directed. There was quite a nice study done by one of our Royal Veterinary College students, and she may have even contacted some of you when she was doing her project, and she interviewed just over 70 farmers who use BVD vaccines regularly, and mainly dairy farmers in this study here. The key points that came out of this were, as I've already said, give the primary course before first service. A lot of farmers were not giving the complete primary vaccine course before heifers were served for the first time. So they could already be carrying PIs before they're fully protected by the vaccine. Make sure you know the correct site to inject in. So is it intramuscular or subcutaneous? This is quite important for the delivery of the vaccine. Boosters directed by the manufacturer depending on the vaccine that you're using. Cold chain was another thing that came up. A lot of people would pick these vaccines up from the vet practices, and then they'd stay in a hot car or a hot office for several days before they were used. We need to make sure they're stored correctly so that they're as efficacious as they can be when they're injected into the animal. And then another big thing that came up is once the vials are broached, these vaccines need to be used within a recommended time. And I think Fraser will correct me here, but it's usually about 10 hours, I think, that the vaccines need to be used by once you've put that needle in the vial for the first time. So do make sure you follow these recommendations. And in effect, you'll get the most out of your vaccines if you're doing this properly, because otherwise it could just be money down the drain if you're not using them correctly. Once we've gone through the process of discussing biosecurity and vaccination, the next big step is deciding whether or not your herd is infected with BVD. And this, to me, is quite important. And if we just talk about the lab tests, so no vet fees here, but the lab tests alone will probably cost you in the region of about £50 to screen your herd to find out whether you're infected. So for £50, we could say your herd is likely to be infected or it's very unlikely to be infected with BVD. So a small number of tests here and pretty cheap, really, I think. If it looks like you've got, we'd enter this surveillance phase, which is basically this step repeated regularly. So young stock tests maybe twice a year, if you can, once a year as a minimum, I would say, and bulk milk tests maybe once every quarter. So not a lot of effort here, I think. If your herd does look like it's infected, and we'll talk about what these different tests might tell you in a minute, and you've got active infection on the herd, the key thing is to find your PIs and cull them. So we want to find the PI animals and cull them out of the herd. And then once you've had a long enough period, generally we say 12 months, without the discovery of any more PIs in the young stock, you can enter the surveillance stage. So in terms of our herd screen, what do our different infection categories of herd look like, and how can you determine which category your herd falls into? If we look at a herd of animals and we have a PI, which is a red animal here, and then we have a green animal, which are the ones that have come into contact with the PI and then developed antibodies because they've been infected with the disease and they've eventually got over it and they have this immunity because they've come into contact with a PI animal. And then we have these white animals that are immune, so at this time they haven't come into contact with the PI, but they will eventually, and then they'll seroconvert, produce antibodies and become green. A herd with a PI animal might look a little bit like this. So you have a PI in the middle here, and gradually more and more of the herd will turn green. As more and more of them come into contact, become infected with the virus this PI is carrying, and then they produce antibodies to the virus. And so what we tend to see is one PI in amongst a lot of immune animals in the herd here. In a herd that doesn't have a PI animal, we may still see immune ones because they've come into contact with a PI maybe 3 years ago. The immunity tends to last, the antibodies from infection tend to last for some time. So you might find you have a number of antibody-positive older animals in the herd, but the younger ones who haven't been in the herd when the PI was present, these will be naive, and these are susceptible to the infection if the virus is introduced into the herd. So if your biosecurity is not good enough or you're not vaccinating, these white animals in this herd would be susceptible to the virus. And then in my studies anyway, I find these herds quite rare. So these are herds that don't have PIs, haven't seen a PI for many years, and don't have cows with antibodies and don't vaccinate. And so these herds are completely naive. That means they're very susceptible if you were to introduce a persistently infected animal or even an acutely infected animal into this herd. So we need to think very carefully about biosecurity and vaccination in these herds. If the biosecurity isn't good enough, we should be thinking about vaccinating in order to protect this very susceptible group of animals we've got here. So how do we tell which herd we have? Lots of you will have done this, so bulk milk antibody tests are probably the first place that a lot of vets and farmers will start. If your bulk milk doesn't have any antibodies and it's antibody negative, that tells us that your herd hasn't been exposed for some time. If your bulk milk is antibody positive, that tells us that your herd has been exposed at some point. And if we think the antibodies last for a long time, so in an older animal that's been exposed, she may have been exposed 3 or 4 years ago, this could be quite a historic level, quite a historic indicator of exposure in your herd. What we could do, though, in this herd particularly, is test some first lactation heifers and test them for antibody as well. So it could be just as simple as stripping your 10 youngest heifers into a jug at milking time and then putting that into a bulk milk pot and submitting it for a bulk milk antibody. And if the heifers are negative, it tells you that these young animals in your milking herd haven't been exposed to the virus, and so you're likely to have a herd that was exposed some time ago but isn't infected currently. So we can use bulk milk antibody quite well, and if you talk to your vets about that, they can devise a program that uses the bulk milk antibody tests. Can we test the virus for milk? There are a lot of labs that are offering virus tests on milk. The answer is yes, we can do this, and the tests are very reliable. But my one caveat with this is probably that if your herd tests negative for virus in the milk, it could just mean that there's a PI somewhere else in the herd. So it could be in the heifers, the dry cows, the young stock, anywhere else. The virus tests on milk only test the animals that contribute to the tank. So if you have a negative test, don't think that automatically means that your herd is negative. A negative virus test, don't automatically think that that means your herd is negative. Antibodies, to me, are better because they're looking at exposure of the whole group of animals. And so because they last for a long time, if they're present, they'll tell you whether there's a PI that's running around your farm, even if it's not contributing to that bulk tank on that day. The other thing that a lot of you will probably have done is test for antibodies in your young stock. So this is done on a blood sample in the young stock, and the ideal age is 9 to 15 months. I've got 9 to 18 on the screen here, but 9 to 15 months is what I would go for. If we test a 9-month-old animal and it has antibodies to the disease, that means that in the 9 months it's been present on the farm, it's been exposed to the virus at some point. And so if we look at this herd at the bottom here, PI in the middle, PI calf perhaps, and these are other animals in its group that it's kept with, you'll see high levels of these green seropositive, antibody-positive animals in this group. And if you've got high numbers, if you test 10 animals and you've got a large number of those that come back positive, it's likely that they've been exposed to a PI. And because we've tested it at 9 months old, we know that in the last 9 months this must have happened. So it gives you a really up-to-date status for your group of animals, and if there's enough mixing on your farm, it gives you an up-to-date status for your farm as a whole. Conversely, if we test a group of animals and none of them are antibody positive, the reason for this is that they haven't been exposed. And so if you test a group of 9-month-old animals and there's no antibodies in there, you just pick the animals randomly, and if there's no antibodies in there, the likelihood is they haven't been exposed. That gives you a status for that group, and if that group has contact in some way or another with the adults and with other young stock on the farm, it can give you a really quite an up-to-date status for your farm as a whole. So these young stock results give you a much more recent result than bulk milk antibody alone. Two things. Ideally, we want to catch them before you vaccinate them, so 9 months is ideal in most cases, and after the maternal antibodies, after the colostral antibodies have waned. And so again, this tends to be by 9 months, most colostral antibodies will have gone, and so if we test 9-month-old animals, it's almost a perfect time here. This just graphically illustrates this again. So if we've got, I think there's 100 animals on this screen here, and if we've got one PI, what will happen with this PI is that she'll cause the others around her to seroconvert, so they turn green, and eventually more and more will seroconvert as the disease spreads through this group of animals. And so if we randomly pick 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of these animals, we'll find you'll get roughly 70%, so 7 of them will be seropositive to the disease, all because they've been exposed to this animal and the virus has spread through the herd. So young stock antibody screening on a small number of animals, which will cost you about £40 in terms of lab tests, can give you an awful lot of information about the entire group of animals that you're dealing with. It doesn't tell you where the PI is, but it tells you that it's it doesn't tell you who the PI is, sorry, but it tells you that it's present and that you probably need to go and look for it. So, our screening and monitoring, we can use bulk milk, we can use young stock blood samples, and we can use first lactation heifer milk samples as well. And the key thing about all of these, particularly if your herd appears to be BVD free, is to repeat them. And ideally, I'd like to get young stock blood samples twice a year, and bulk milk samples and first lactation heifer milk samples probably yearly. But talk to your vet about this. Develop a surveillance program with the vet. So very cheaply, we can discover what your herd status is for BVD. And like I say, if there's no PI animals present, we can just go on and undertake further surveillance and really re-emphasize this step up here of biosecurity and vaccination and protection. If your herd does appear to be infected with BVD, then what we need to do is find the PIs and cull them out of the herd. And once we've culled them out and we've been free for 12 months and haven't found any further PIs, then we can start to go back to this surveillance stage again. So in our infected herds, what are our options? We could do nothing, and I've crossed that out immediately, but some people might not want to do anything about the disease. We could vaccinate, but we know that vaccine alone is not going to eradicate this from a herd, so we probably need to do something else. So we need to look for PIs. And the gold standard and the quickest way is probably to control PIs, cull PIs, and vaccinate at the same time. So if we're looking for PIs and vaccinating, we're probably going to get to an eradicated state a lot quicker. The other thing we do need to think about, and this isn't a topic I can get a lot of farmers enthused about, but it's biosecurity. But we need to find simple ways of making biosecurity work for you, and you and your vet can do that together, just knowing your farm, I think. So in our infected herds, hopefully I've highlighted this multiple times now, but what you need to do is find the PI animal. You need to find them and remove them. So get rid of these PIs out of infected herds. And we have very good antigen and virus tests out there. So they look for either bits of the virus or bits of the viral genome on the blood tests and ear tissue tests. And these are very effective at identifying these PI animals. And so, again, we've got good tests, and you'll get a good set of results by testing and looking for PIs. So do talk to your vet about how you're going to use these antigen tests and virus tests within your herd. The herds that we often forget to talk enough about are our BVD-free herds, and as Fraser said earlier, in some of the areas of the country, we'll have 50% of herds that are BVD-free. So we need to make sure we protect these herds properly. So it's all about assessing, improving and maintaining biosecurity. And this might be your chance to start to look at other diseases as well. If you're BVD free, there's always something else that you need to worry about. So it could be the chance to look at IBR or Johne's and to work that into your biosecurity program as well. Assess your need for vaccination. If your biosecurity is excellent and you don't have any worries about boarders and purchased animals, you may not need to vaccinate. But if your biosecurity isn't good enough, then do think about how you need to use this in your herd in order to protect it. So for BVD particularly, I class this as another tool in your biosecurity toolbox. Then the other big thing, I think, is to set up a surveillance system to monitor for disease incursion into your herd. A farmer I was working with, he had a PI, we'd found it, we culled it out, and we got him BVD free. We undertook surveillance on a yearly basis for the young stock and quarterly for the milk samples, and when we tested 10 young stock one year, we found that 2 or 3 of them had started to seroconvert, so 2 or 3 of them had gone green. And this was a trigger to look at what had happened in the last year since his last clear surveillance test. And he had brought in 4 animals, and one of those turned out to be PI. But by performing regular surveillance, we were able to pinpoint those 4 animals as the risk animals and go and test those and get him BVD free very quickly again, in fact. So regular surveillance can help you act very quickly and identify the problem animals in your herd. Monitor your bulk milk quarterly, young stock every 6 months ideally, but yearly at least. And think about using your first lactation heifers. Talk to your vets about which milk samples are the best ones to take in order to monitor for BVD. And one of the biggest things is possibly just to set up a reminder system, write it in your diary, put it somewhere where you're going to see it, because it's very easy to forget that your BVD tests are due and to let them slide. So set up some sort of reminder system. So that really brings us to the end of the flow diagram here. We've found our PIs because we've got good tests and we can identify them. And it might be that you do this all in one go. You find these and you cull them out all in one go, or it might be that you test cohorts over time, or you test young stock as they're born into the herd initially. And a lot of you will probably be tag and testing, and that's what that's doing. It's checking the young stock. But until you've checked everybody in the herd, you don't have a full status for everybody. So it's a slightly longer process to BVD freedom. And once you get to that point where you've removed all PIs and you've tested for 12 months and you haven't found any more, you can enter the surveillance stage of your program. So if you're worried about BVD and you see any of these effects that we talked about in the last presentation there, talk to your vet. Talk to them about the diagnostics and see if you can develop a tailored diagnostic plan for your farm in order to find out your herd status. Talk to them about the risks in terms of biosecurity and vaccination, and really, I think, start to develop some sort of herd health plan, because this is a disease we can do something about. The tests are good, they're not that expensive, and we can get you BVD free in a relatively short period. 2 to 3 years probably for most farms if they're committed to getting rid of PI animals. So we can move on and we can get BVD free, and then we can move you on to the next disease that you're concerned about. So I'll just hand back to Fraser now and take any questions that have come in.
Okay, so thanks very much for a very interesting overview and insightful overview on diagnosing the condition and achieving a BVD-free herd. We do have a few minutes for questions, so if you do have any questions, then please type them into the chat box. Thank you. We'll wait for a few minutes for you to think about your questions. At the moment, we'll hang around for a few minutes. So to go to the questions, you click on the chat button and then type them in. If you have no questions, that's absolutely fine. If you do think of any questions afterwards, then just email them across to me at fraser.broadfoot@merck.com. And if you email any questions to me, then we'll get them answered. or speak to your vet if you have any questions as well. Everyone for listening, and thank you very much to Dr. Richard Booth for the presentation. So I hope you have a good evening. I was ahead of myself there. We have a question from Claire, and Claire says, we've got another more questions. They're all coming in now, so that's good. That's good. So the question from Claire is, if you vaccinate or buy in vaccinated animals, they will be positive. So if part of a milking herd, the BMT will be antibody positive.
So that's true, but I think the biggest thing is that it won't affect the test that we need to do on them in order to check if they're persistently infected. So you can buy in vaccinated animals safely. They will contribute to your bulk milk, but if you were to do something where you only milk tested your first lactation homebred heifers, then you can exclude those bought-in animals so they don't necessarily affect your bulk milk antibody result there. So there are ways around it, I think, and so you don't need to worry about buying in antibody-positive vaccinated animals. The key thing is that we can still test them to make sure that they're not PI themselves, and that's the main thing we're trying to prevent coming onto your farm.
Okay, thank you. From Gillian follows. So she says, I vaccinate my heifers between 9 and 12 months. When is the best time to give a booster once the heifer has calved?
So really, we need to look at so after the animals have calved, and once they've entered the main herd, I think the key thing is to make sure that the boosters are given regularly enough, and that they don't, because on a lot of farms, I think what can happen if a heifer is delayed getting into calf, it can enter the main herd maybe after the main herd's boosters are due, and it might go another year maybe without a booster there. So I think thinking of the timing of the heifers entering the main herd is probably the key thing here, and to make sure that the booster timing for them is correct, and that really needs to be done according to the manufacturer's instructions for the booster that you're using there.
Okay, thank you. So I think it looks like they're the two questions that we have. If you do think of any in the next few minutes, then type them away. But just to say thank you once again for listening, and thank you for Richard for an excellent presentation. Thank you.